members of the faculty, distinguished guests, family members, and friends of the graduates, and you, the 2021 graduating class of the Yale School of Public Health. It is a personal pleasure and a privilege to speak at your commencement, and it is truly an honor to speak to the graduates of one of our oldest and most distinguished schools of public health in the world. It is also especially meaningful to me as so many members of your faculty have been close colleagues, collaborators, and friends for many years. This is an extraordinary time to enter the field of public health. The challenges posed by the COVID-19 pandemic at home and abroad have brought into sharp focus the world's need for the science and art of public health professionals and the imperative of robust support of our public health enterprise. The COVID-19 pandemic has upended our entire planet, challenging past assumptions about our preparedness for a global pandemic. COVID-19 has at least 4 characteristics that have allowed an historic assault on humanity. First, it is caused by a virus that, to our knowledge, never had infected people in a sustained manner. Second, the virus has extraordinary transmissibility from person to person. Third, it has a high level of morbidity and mortality, especially among seniors and those with underlying comorbidities. And fourth, like so many other diseases, such as HIV, TB, diabetes, kidney disease, and others, COVID-19 has exacted a disproportionate toll in minority communities, especially African Americans, Hispanics, and Native Americans. It indeed is the perfect storm of an emerging infectious diseases, or, as I have worried about for years, my worst nightmare. And so, the expertise, energy, passion, and commitment that you soon will bring to the world amid COVID-19 come at a most opportune time. Rarely before has the world so badly needed the skills inherent in the many disciplines represented by this class: epidemiology, biostatistics, public policy, community health, health economics, and many others. Public health in 2021 is truly, to use the parlance of business and economics, a growth industry. I must tell you, the immediate and urgent need for the talents and training that you possess were less apparent when I was embarking on my own career in medicine. In 1968, I completed my residency in internal medicine in New York City. Around that time, various health experts and pundits had opined, believe it or not, that the threat of infectious diseases was nearing an end. This view was rather widely held. Great advances with medical interventions, such as antimicrobials and vaccines, had engendered great optimism. And some went so far as to suggest that it was time to close the book on infectious diseases and shift public health resources to chronic diseases, thus adding new meaning in my mind to the word provincialism, since malaria, TB, vector-borne diseases, and so-called neglected tropical diseases continued to rage in low and middle income countries. Against this backdrop, in 1968, I was on my way to begin, of all things, an infectious diseases fellowship at the National Institutes of Health. And so as I drove south on the New Jersey Turnpike from New York City to my new job, the words of the pundits, many of them renowned experts, rang in my ears. I had a sinking feeling that I might be obsolete even before my career had begun. A bit like training to be a VCR repairman. Unfortunately, the pundits were dead wrong. They declared victory prematurely. And for the football fans among you, this was sort of like spiking the football on the 5-yard line on an open field run. For at about this time, scattered cases of a strange wasting disease were being noticed by missionaries and healthcare workers in sub-Saharan Africa, off the radar screen of the Western world. The sparks of the HIV pandemic had already become a low flame, and soon a growing fire that would transform the world, and for me, my professional career, if not my entire life. Of course, in the 40 years following the recognition of the AIDS pandemic, we have seen dozens of disease emergences. The past 12 years alone have brought H1N1 swine flu in 2009, chikungunya in 2014, Zika in 2015, and multiple outbreaks of Ebola in Africa from 2014 to the present, just to name a few. Now, obviously, not every opportunity or challenge that you encounter will influence your careers and your lives or be as dramatic as a frightening infectious diseases outbreak. However, please believe me when I tell you that something akin to the unpredictable events that I have experienced in my life and in the evolution of my career are going to confront you regardless of what directions your careers and your lives take. And so expect the unexpected and seize the opportunities to make a difference when the unexpected arrives. Over my career, I have learned that when a new health challenge emerges, it is critical to not downplay its severity and never underestimate its potential to become an endemic or pandemic. We have been through this over and over, and usually we only see just the tip of the iceberg, or, to use another metaphor, the eyes of the hippopotamus, while the vast burden or potential burden of diseases lies beneath the surface. And so consider HIV and AIDS. 40 years ago next month, in June 1981, we learned of 5 gay men with a strange new disease without a name or an etiologic agent. Then 1 month later, an additional 26 young gay men, then injection drug users, heterosexuals, infants, and thousands of others in the Western world, before we even began to appreciate the huge and growing burden in sub-Saharan Africa. Still, some suggested that the problem would go away or stay confined to mostly marginalized people. But as we would painfully learn, the body of the hippopotamus lurked beneath the surface. Fast forward 4 decades, we now have 78 million people with HIV, and more than 32 million have died. With COVID-19, I am sure many of your mentors have felt a certain deja vu, with promises that the pandemic would disappear like magic, even while the pandemic surged with tens of thousands of cases and thousands of deaths each day. At a time when we should have been focused like a laser on the historic challenge facing us, when decisions and public health messaging should have been driven by data, we too often heard happy talk. As has happened too often before, victory was declared too soon. We must not let that happen ever again. When a new public health crisis arises, if it feels like you are asking too many questions, issuing too many warnings, and communicating too much, then you probably have it just about right. With COVID-19, as with HIV and previous outbreaks of unrecognized pathogens, the scientific community had a steep learning curve. We have learned collectively to be open-minded and humble enough to change our recommendations or our guidelines, our policies, depending on the evolving data. If a situation is static and does not change, then stick with the data at hand. If the situation is evolving before your eyes, stick to the science and go with the data as it evolves. If you look at what we knew 15 months ago compared to what we know now, our understanding of COVID-19 has grown almost exponentially. The role and utility of masks in blocking transmission, the spread of SARS-CoV-2 by asymptomatic and pre-symptomatic people, the importance of aerosol transmission, especially in indoor closed spaces, all of these evolved dramatically and rapidly, as did our understanding of the pathogenesis of the disease and how to treat it. We must always let data drive our decisions. In the current pandemic, our response has sometimes been distracted and precious time and resources wasted by the inclination to just try something, anything, a Hail Mary pass, if you will, based on anecdotes or a hunch that something might work. Unproven drugs were touted on the internet and social media by politicians and even some medical personnel who sometimes made the incorrect assumption that the benefit of these approaches would outweigh any harms. Randomized controlled trials of many off-label therapeutics often eventually proved a lack of efficacy and in some cases revealed severe adverse events or worsened COVID-19 outcomes. One notable example was hydroxychloroquine. Ultimately, numerous randomized controlled clinical trials showed a lack of efficacy for hydroxychloroquine and a concern for safety. Meanwhile, rigorous trials have proven the utility of several therapies in both outpatient and hospitalized patients. That is, we now have interventions that actually help patients. I would like to leave you with one final thought. Our country's experience with COVID-19 has put a spotlight on one of the great failings in our society, the lack of health equity. COVID-19 has exposed long-standing inequities that have undermined the physical, social, economic, and emotional health of racial and ethnic minorities. With COVID-19, many members of minority groups have had a much greater risk of COVID-19, often because of the nature of the jobs that many of them have as essential workers in society. More importantly, when people in minority groups are infected with the coronavirus, they have a much greater likelihood of developing a severe consequence due to elevated rates of underlying conditions such as hypertension, diabetes, obesity, chronic lung disease, among others, that lead to a multifold increased risk in hospitalization and death. Very few of these diseases are racially determined, and almost all relate to the social determinants of health dating back to conditions that many folks find themselves in from birth, such as limited availability of adequate diet, lack of access to health care, and the restrictions and pressures put upon them by the undeniable racism that exists in our society. Let us promise ourselves that our corporate memory of the tragic reality of COVID-19, an infectious disease that insidiously and disparately hospitalizes and kills people of color, does not fade after we return to our new normal. It will take a decades-long commitment for society to address the disparities that once again emerged during this pandemic. I strongly urge you to be part of that commitment. We must together find the strength, wisdom, empathy, and kindness to address these entrenched elements of injustice, manifested in so many ways, subtle and overt, and work with all our might to remedy the cultural disease of racism, just as we fight the viral disease of COVID-19. Along the way, we always must use data-driven approaches to foster meaningful engagement with community institutions and diverse leaders, and to conduct culturally responsive outreach and research to address health disparities. If ever there was going to be a real incentive for us to make a commitment to address these social determinants of health, it has got to be now. Thank you again for the great honor of speaking to you today. Congratulations to you, to your families, and to your loved ones. Good luck, and God bless you.